makes sense. All right, team. So let's just go back to what we were discussing. So Shruti, I think you joined 1 or 2 minutes late. So let me just recap. So what we were planning to do in today's call is we will discuss where SLR fits in with respect to the jobs that are currently existing in the market and what are the steps of SLR. And we will also deep dive into one project in which we have done, which I have done with my team, and that can be, I have streamlined the approach. So typically the SLR project goes, if it is not a very elaborate one, minimum 3 to 6 months. So what are the steps that a team takes to complete it, and what are the results that we share, and after that, what are the things that are done? How is that project used by the stakeholders? In our case, let's say we take a project from Novartis, they give us a project. How we will take it, what are the questions that we will ask them, what are the steps that we will do, and how we will do it, and then what is the answers that we will be giving them in the report form. So that's what we will be focusing on our today's session. Let me just start with the first step. Akash, help me read it, please.
Yes, sure. So topic is where SLR fits in the job description. Systematic literature review. SLR is a critical part of research roles, especially in academic, scientific, and analytical jobs. SLR fits into roles that require deep research, analysis of previous work, and synthesis of insights. Typical positions where SLR is essentially include academic researcher. SLRs help in reviewing what has been done before, identifying gaps, and forming the basis for new research. Then policy analyst, and they use SLRs to summarize and provide evidence for policy making. Healthcare or medical researcher. SLRs are crucial in healthcare to collect and analyze clinical trials and studies. Market research analyst. In business, SLR helps in gathering and analyzing existing market research. Employers expect candidates with SLR experience to have skills like critical thinking, data synthesis, and writing clear evidence-based conclusions.
So I always emphasize, in our last call also I mentioned that
Mhm.
we are like cops. We have to make sure that we gather the right evidences, and based on the evidences, we give our conclusions that is in the form of a report to the stakeholders. So HEOR projects or market access projects are exactly like that. Evidence-based research. That is the key term. Anytime you guys are in a job interview and you guys are asked, like, hey, what do you understand with what is the main thing that you have to consider while doing SLR project? There are so many things that you can summarize. We have to search the right data engine, and we have to do this, and we have to do inclusion, we have to do exclusion, this, that. But the main focus always is this is an evidence-based research, and we should make sure that we always talk about this one point in our job interviews. That will make them understand that you guys have a clear understanding of why exactly we are doing it. So as I mentioned, there are different dimensions in which SLR is used. You can see that SLR can be used in academics, scientific, in analytical jobs. So when we come about academics, I'm not talking about going and teaching. Academics means in the research, in the academia field, you guys see there are very top high impact journals, and in high impact journals there are publications made, and that publication made is for the research purposes, and also quite a lot of time there are very defined professors in US and UK. I have seen it less happening in India, but here also the top universities do that academic researches, and they include folks in which they are hiring people as a research scholars, and those research scholars are undergoing these researches. So there are very good high paying jobs, and you can also apply for this. Once you do this research, you can collaborate with it with writing the professional net exam, and then you can get jobs as a assistant professor and also be doing research for big companies. Why it is critical is because you get a lot of funding. Like the professors are doing a lot of researches, and you know that they all go into seminars, so they hire folks, research scholars, and when you are hired as a research scholar, the package starts somewhere around 70K, and it goes as per your skills. You can bargain with the team and you can get it. So there it fits in. So when you are part of the academic researcher, then SLR helps in reviewing and what is already in the system. Let's say I was working, like in my good old college days, I was working under my professor and I was doing research on breast cancer. So, and as a PharmD, so it was clubbed with, I was from Manipal, so it was clubbed with our hospital. So I did write a paper where I was going through the patient files and I was seeing all the data that is in there. And then once I did review the already existing files, I was trying to understand the gap. I was doing for HER2, giving you an example. So I tried to understand the gaps, like, okay, in the system, what doctor is doing and where we can add value, and then what was the disease prognosis, and when exactly which drug was helping them have a better life, and which drug was not really adding value for HER2 receptor specifically. So that is something that if you are looking forward for a career, long-term career in research field, there are n number of great opportunities outside India. They give you a lot of value, and if you do it in India, you can also apply for postdoc abroad, which will have a very high package. One of my friend, he did it from University of Philadelphia, and after that he was able to get a very good job in the clinical CRO form of Philadelphia only. So giving you an opportunity with respect to opportunity, what is happening. Policy analyst, if somebody can tell me what are the healthcare policies, any understanding of that? Swati, if you can just give it a try, a random try, what I'm talking about when I come to healthcare policies.
No, I'm not able to.
This is a very interesting topic. If I get time, this is going to be a deviation. So what we will do is that let me put this as a question for you guys to read about healthcare policies and how it will be impacting SLRs. And in our call tomorrow, we will discuss this. I think 5 minutes I'll take to give you guys a little bit of glimpse of what exactly healthcare policies are and how it is impacted and where exactly we can add value. So please, Akash, can you just put it on chat so that we all remember that we have to do this as a homework?
Yes, sure. On top of my head, there is one policy coming on. I'm not sure if it is right. So, will ICH GCP will come in healthcare policy?
Yeah, so basically just let me give you a little bit of glimpse so that you guys will have an easy understanding and it'll be easy for you to know. So there are different government policies that come in. So when I talk about healthcare policies, you can go to, let's say, what is UK policy for cancer with respect to reimbursement. So they will, there 2-3 times if you will put it, no, then you will understand that government make different policies. Like in India also, no, we have this government policies of you can go to this, Modi has brought something that you can go to the hospital, or the folks who are underprivileged, and they can get certain things done. So these kind of things in India, this is a very primitive stage, but in US and UK and other European countries, healthcare policies are like heavenly. Even the very high costing diseases, that is covered. So government collaborate and they have their own team. They do the policy making, and that policy making is basically determining quite a lot with respect to revenue and other things for pharma industries. Am I making sense?
Yes.
So it would include even the when we talk about with regards to insurance also, right? Like for example, here in India we have that Ayushman Bharat, etc.
Exactly.
So all that also. Okay, got it. Okay.
There is an interdependency. They are all connected. So read about it, and then I'll take you guys can read about it and help me write it for let's say take. I will not take EU5 again. So you guys will do it for EU5 and Australia, policies in Australia, and at least maybe 1,000 words, and it should be in bullets. Nobody will be sending me deep, big paragraphs. Okay. No big paragraphs. You guys know whom I'm talking about, but no big paragraphs.
Okay, okay.
Bullets. It should be presentable. It should have bullets. Make it look appealing so that I love reading it. I don't have to do it like a task. Okay.
Got
So bullets, and take a little bit 30 minutes of time to make it presentable for me so that I can be like, yeah, this person made me read it. It's so beautiful that I love reading it. So do it like that. So policies with respect to EU5, Australia, and US. So you guys can do some newsletters. So when you're going into the system, just add news with respect to healthcare policy, something new you will also tell me, and I'll tell you something which I already have in mind. So we can discuss this tomorrow, okay?
Yes, okay.
All right. So now the third point is healthcare and medical researchers. So we already know that healthcare folks do SLRs, and it is very crucial for them to collect and analyze the clinical trial studies that we have already discussed about, nothing new in there. And I've also discussed in our last call, as an analyst, when you're joining corporate world, you will be getting jobs where you will be doing SLRs. There are a lot. I mean, there are n number of vacancies. You just go to LinkedIn and you put in market access analyst or HEOR analyst, and there are big HEOR teams. So it's everywhere now. It's like a booming part of consultancy business with a lot of money. So that's where we get our jobs. I am into that field myself. So this is how it works. So these are the major places where folks with SLR knowledge get a lot of opportunities. I will like to add in, if you guys have a good understanding, just the basic primitive level, you will be able to get entry-level jobs, and the jobs are really cool. I mean, you will have a lot of knowledge and overall sense of satisfaction with respect to work life and all, because they also give remote, etc. That's very good. So you guys can definitely have this in mind while you're